Okay, so this is the last section of our reproductive unit. We're talking about pregnancy and birth. So, pregnancy is, of course, the events that occur from the point of fertilization of the egg until the infant is born. The conceptus is another name for the developing offspring. And the gestation period lasts from the last menstrual period until birth, which is typically 40 weeks. The embryo occurs at is a conceptus from about the 3rd week of pregnancy through the 8th week. So you can see in that picture there, that 3rd week is really when those cells are really starting to form. You've got that placenta starting to develop around that embryo. Although at that point, and around the 3rd week, most women don't even know that they're pregnant yet. So it's usually not until around the 4th or 5th week that you might discover that you've missed a period and start to suspect something. The fetus is the conceptus from the 9th week through birth. So from 0 to 8 weeks, it's called an embryo, and from 9 to 40 weeks, it is a fetus. For fertilization to occur, a coitus must happen no more than 3 days before ovulation or 24 hours after ovulation. So it's actually a very small window each month that a woman can become pregnant. Fertilization occurs when a sperm fuses with an egg to form a zygote. The sperm has to survive long enough to reach and penetrate the egg, but there's a lot of obstacles that it has to go through in order to get there. So the sperm will secrete enzymes that help it to get near the protected egg, because the egg, while ultimately that's what it's there for, is for the sperm to fertilize, it still sees sperm, and so does the female body, sees sperm as a foreign entity, a foreign invader that's going to try to protect itself from. There's proteins on the surface of the sperm that will bind to the surface of the egg, and this is when fertilization can occur. But sperm can survive in the uterus for up to 5 days, and if ovulation happens anywhere in that 5 days, fertilization could possibly occur. So here you see the sperm reaching the egg, and it has to make its way through the layers of tissue or layers of cells surrounding the egg. And the proteins are going to bind to the surface, and then it's going to slowly make its way into the egg itself. And you see the different parts of the sperm there. You've got the nucleus, was at the very head. And the acromal reaction is what helps bind it to the surface. So immediately following sperm penetration. So the egg only wants one sperm to enter the egg. Otherwise, you'd have too many chromosomes and you couldn't possibly have a baby. So what happens first is it enters, and the tail of the sperm breaks apart, and you're left with the nucleus. And then you've got the nucleus of the ovum. So then the male pronucleus and the female pronucleus begin fusing here. So you can see here they fuse. And at this point, and D here, we formed a zygote. And then the process of transcription and translation can start to happen. So the chromosomes of the sperm and ovum have combined, and they're starting the process of the first cleavage of the cells, creating 2 daughter cells that now have both the genetic material from the father and the mother. Implantation begins 6 to 7 days after ovulation, and the implanted blastocyte is covered by endometrial cells. So that's the lining inside the uterus. So that egg is going to implant and bury itself into the wall of the uterus. And it's completed by about the 14th day after ovulation. The human chorionic gonadotropin hormone, or HCG, prompts the corpus luteum to continue to secrete progesterone and estrogen. If you remember, the corpus luteum is that the remnant after ovulation that was in the ovary. So for the first few months, it takes over the secretion of the hormones until the placenta is in place. Between the second and third month, the placenta assumes the role of the progesterone and estrogen production and helps provide the nutrients to the embryo and remove the waste. So, pregnancy tests are designed to detect the rise of that HCG hormone. So you can see here, after ovulation and fertilization, the levels of that hormone dramatically rise in those first few weeks. So, and pregnancy tests are becoming more and more sensitive, so it's becoming closer and closer to detecting pregnancy earlier and earlier. So as soon as that HCG hormone gets high enough, then pregnancy tests can detect it. So the placentation, this is begins about 7.5 days after implanting. So here the egg buries itself in the wall of the uterus, and then the cells start to be stimulated around that developing cell right there. And this is the beginnings of the blood supply happening and the amniotic fluid starting to happen here. So it's beginning to make the placenta, but it's going to take time. The yolk sac provides early blood cells for the fetus. The amnion-filled fluid helps provide buoyancy to the baby, helps it maintain temperature, and the fluid is formed from the maternal blood. So at this stage, at about 4.5 weeks, most women may only be finding out that they're pregnant. So by the time you find out, you already have the beginnings of an embryo here. It's already got arms and legs and things like that. Here is about a 13-week fetus, so they start to look a lot more baby-like. They've got recognizable features, but they're still very, very tiny. The primitive streak is a raised dorsal groove that establishes the longitudinal axis of the embryo. So if you divide a human body into from the top of your head to your toes, you're pretty much the same on each side of your body. Now, certain organs may tilt certain ways, and not all the organs are exactly identical each side, but you want to have that longitudinal axis so that your body is bilateral. The primary germ layers of the embryo, and by germ layers, these are the layers of tissue in that early embryo that's going to give rise to all of your tissues, all of your organs, all of your bones. So the ectoderm will form the nervous system and skin. The mesoderm forms all other tissues, and the endoderm forms the lining of the respiratory, digestive, and urinary systems. By the 8th week, all organ systems are recognizable. Obviously, they're not functioning yet, but they're all in place and they're continuing to develop. So the cells differentiate into different organs and different structures, which have different functions. And the ectoderm creates the folds that will create the spinal column and the brain. So before conception, so you can see basically the size of the uterus, how it expands. So it's very small before conception. At about 4 months, it's a little bit bigger, 7 months, and then 9 months. The human chorionic somatomammotropin, HCS hormone, stimulates the maturation of the breast in preparation for milk production. Human chorionic thyrotropin helps increase maternal metabolism, and this is kind of what makes pregnant women so hungry all the time. The parathyroid hormone levels are high, which ensures a positive calcium balance, because you get a baby that's sucking up a lot of calcium, making those bones. The GI tract, so morning sickness occurs due to the elevated levels of estrogen and progesterone. Urine production increases to handle the additional fetal waste. The respiratory system, edematous and nasal congestion may occur, which is basically, coughing, having trouble breathing, especially late in pregnancy. The cardiovascular system, the blood volume increases 25 to 40%. So typically people, you can see a raise in blood pressure if the blood volume gets too high. So as you can see, basically all of the other organ systems are completely working just to create that offspring. So your entire body becomes focused on changing and doing things that help that offspring, that help that fetus develop. So estrogen peaks during the last weeks of pregnancy, causing myometrial weakness and irritability. And this is as it's getting ready for labor. Braxton Hicks contractions may take place, and these are weak contractions. They are not real labor contractions, but sometimes they can make moms feel like they are. As birth nears, oxytocin and prostaglandins start to cause uterine contraction. And the activation of the hypothalamus can cause emotional and physical stress, but there's a positive feedback mechanism that releases more oxytocin that starts to get the mom ready to meet her baby. So as labor occurs, the uterine wall contracts, and it contracts very strongly. The cervix at that point is very thin and has dilated to reach 10 centimeters. Before that, it was completely closed and it was thick, and there was actually a mucus plug that holds everything together. But as labor nears, that thins, dissipates, and dilates. So the baby is typically born head first. You can see how they have to kind of twist the head under the pelvic bone. The delivery of the placenta is accomplished within 30 minutes of birth, so all the placenta and all that afterbirth has to come out as well. All placenta fragments have to be removed to prevent postpartum bleeding, so even if a little bit of tissue is stuck there, it will cause the mother to start to bleed profusely, and they might have to go in and surgically remove it to stop the bleeding. Once carbon dioxide is no longer removed by the placenta, central acidosis occurs inside the baby. This excites the respiratory centers to trigger the first inspiration, and this requires tremendous effort as airways and the lungs have been collapsed up until this point, and they have to inflate. The surfactant has to be released to reduce the surface tension. So all this is happening just for that first breath. For the first 30 minutes, infants are alert, their eyes are open, their breathing is increased. So this is kind of the transition period. After, infants usually sleep for several hours and only wake periodically every once in a while. The prolactin hormone stimulates lactation, and colostrum is released first. It is a solution rich in vitamin A, protein, minerals, and AGI antibodies. And this is released for the first 2 to 3 days until the true milk production begins. But that colostrum is very, very important for that baby to get. It provides them with a lot of really important things that are very good for them. So, most moms are encouraged to at least breastfeed for the first few days, if not first few weeks of life.